like that if you can all turn your microphones to mute so we can have a more fluid conversation between Dr. Volberding and Dr. Arvay today. So we have joining us today Dr. Jennifer Volberding, which she is the department chair for the athletic training program at OSU Center for Health Sciences. She received her Doctor of Philosophy in Higher Ed from the University of Kansas in 2011 and her Master of Science in Sports Med from Georgia in 2003. In addition to her chair role, she is an associate professor with the School of Allied Health at OSU Center for Health Sciences, where she joined the faculty in 2015, but she really began working at OSU in 2010. Throughout her career, she held other teaching positions with various universities, including the University of Kansas, Seton Hall University in New Jersey, Georgia State University, and Boston University. Erik Arve, who is an OSU athletic training alumni, is a current intern athletic trainer for the New Orleans Saints NFL team. Erik is a 2020 graduate of OSU Center for Health Sciences Master in Athletic Training Program. Wow, that's a mouthful. Who is now working as a seasonal athletic trainer for the NFL's New Orleans Saints. Before earning his degree at OSU CHS, Arvay was a physical therapist and a strength and conditioning coach. While he always appreciated working with athletic trainers, his interest in becoming one didn't start until he provided physical therapy services at a local high school. When Erik began researching athletic training programs to enroll, the two things that were important to him were a knowledgeable and accomplished faculty and quality experiences. He says OSU CHS has provided both of those qualities. So thank you both for joining us today. What I'd first like to start off is by discussing the program and the history of OSU athletic training and how it fits into the OSU system. So what I'd like to hear about is the move from Stillwater to Tulsa and some highlights from the past few years.
Sure. So welcome, everyone. It's nice to see a few of our alumni here. Hi, Martin, Erica. Always great to see your faces. So as many of you know, that the OSU Athletic Training Program has a very long and well-established history here in the OSU system, as well as within athletic training accreditation pieces. Thank you, Doc Fair, as well for being a part of that beginning of our athletic training program over in Stillwater. So we began as a bachelor's program, and then as the climate within the athletic training education and athletic training in general kind of changed, we decided as a faculty to start the move and the transition to the professional master's degree a little bit before our accreditation required us to do that. And so in 2015, our first cohort entered into the Master of Athletic Training program. Now, before we really even talk about the program itself, I think a lot of people have always asked, why did we leave the Stillwater campus and why did we make the transition to the Center for Health Sciences? And I think first and foremost, the biggest thing that we all as a faculty would tell you is that we wanted to be with peer health professions. We were in the College of Education and we're well supported and again, have a great foundation over in the Stillwater campus. But as the accreditation standards changed and became definitely more and more advanced within the skill sets, the requirements, we recognized that while the College of Education had supported us until then, we really needed to be in an area where we had peers who had the same challenges, the same standards, the same ideals. And so when we made the transition over here, we really have emphasized the idea of interprofessional education. And so when 2015, when we made the slow transition, so we did have a year of overlap where myself and a doctoral student were here for about 6 months by ourselves while Dr. Warren and Dr. O'Brien finished out the undergrad program for our 2016 graduates. But we really emphasized and put together a lot of effort to integrate interprofessional education. So we do have overlapping coursework and opportunities where Students have labs and lectures with the College of Medicine. With the PA program starting here in June, there's even more overlap. We've also started offering IPE event days where just a couple weeks ago, we spent an entire day talking about healthcare disparities and healthcare cultural competence, and brought together College of Medicine, athletic training, and actually pharmacy students from SWASU and OU. And so that's really the reason why we made the transition over here. So as we've moved over, we are super proud of our graduating cohorts. We, in the past 2 years, have had 100% pass rate. Our 3-year pass rate is 88%, I believe. But we've really taken a lot of pride in both the success of our students on the board of certification exam, but more importantly, the success of our students going out and getting jobs. And so I'll let Erik talk more about that piece. But right now, we are in the midst of admitting our 2020 class of 2023. As of right now, we have our largest cohort to begin with, or so far, and that is a cohort of 14, which we're really, really excited about. And really, you know, as we have made the transition to the master's program, and as we have adapted our program to meet the new standards, I think I'm really proud to say that athletic training here at OSU is really, really ahead of the curve when it comes to curriculum, when it comes to the type of program. The integration of high fidelity simulation, the interprofessional education opportunities, and just the different approach. You know, we took pride in the fact that the 3 faculty members, be it good or be it bad, sat in a room for many, many days, and we created our dream program. And I think all 3 of us would say that the curriculum, the design, what it looks like is everything that we wanted in a perfect program and more, because we just didn't know about that. So that's just kind of a little bit of the highlights of as we've made the transition, and I will pass it back to you, Emily.
I'm on mute. Erik, would you care to discuss your experience at OSU and what you think the greatest aspect of our MAT program is?
Yeah, so coming out of kind of my physical therapy experience, and actually mentioning the where I really found the desire to go back to athletic training school, Alan Mount, the athletic trainer from Bartlesville High School, also an OSU alum, I think is listening right now. So shout out to Alan for kind of getting me to where I am in some some ways. But yeah, like I really was looking at this next move to go back and get the entry-level master's degree, or professional degree. And you know, I talked to my wife about it. We were ready to move, you know, wherever we needed to move, where we felt like was going to, you know, give us the best opportunity to kind of reach our goals professionally and all that sort of stuff. So obviously it was great to stay in state, but Oklahoma State really offered everything that, like you know, Emily kind of mentioned early on, like I was looking for in a program. The fact that all of the faculty and staff has worked at the level that, you know, I was kind of eyeballing at the time was really important. So, you know, I know they weren't just like book smart, but they had also had like practical experience, which was huge for me. The curriculum was something that I thought was going to be very beneficial. Like having already been to PT school, you know, I definitely was looking forward to getting you know, a different kind of, I guess, perspective on some of the skills that I already had. But like Dr. Volberding mentioned, like being there with the med program and being able to collaborate and interact with those students, and, you know, some like the simulation dummies and working with the EMTs, like it was just so much more than I was really expecting to get in an educational program. And then finally, the opportunity to really kind of, I guess, just have a lot of input into where we went clinically was huge for me. You know, I had a pretty clear vision of what I wanted to do after graduation, and the program really allowed me to, again, have a big input into what I did as far as my clinical rotations. And, all that stuff has set me up to be here, and hopefully staying here. So we will see. But yeah, that was a phenomenal experience, having again just multiple healthcare providers, doctors, again, the EMTs, PAs, like all that stuff, the DO program, all that stuff has provided a very unique experience that, quite frankly, I wasn't expecting, but feel a lot better coming out on the back end of.
Great. Well, it's been really incredible hearing about how this program's transformed and changed throughout the years, coming from Stillwater to Tulsa and working with the College of Osteopathic Medicine. There's so many great things happening in the field. Our CATIE standards, which is our accreditation body, has really started implementing some of the things that we've already pioneered a long time ago, which I think really sets us apart from the rest. And I describe OSU MAT as Candyland because we have all these wonderful experiences, simulation, IPE that we have for us here, and it's really makes us one of a kind. So our next talking point is looking at the transition into the future of athletic training. So I would love to hear some anecdotes from each of you about what you've observed and seen. Who would like to go first, Jen?
So, I think one thing that, we really want to emphasize, and I think is as healthcare providers is really, it's been at the forefront. We were chatting about this before we opened up to the group is what has the past 12 months. It's amazing to think, right? The past 12 months of COVID, what it's done to athletic training and what it's, meant for us to adapt and to create, opportunities and to maintain our high standards that we have. I think first and foremost, somebody asked me a few weeks ago, they're like, how has it been? How have you made it? And I was like, the adage is, if life gives you lemons, you make lemonade. We made really great lemonade the past 12 months, but I'm sick of lemonade, right? I'm really tired of having to make new lemonades. But, for us as a program, we have really adapted quite well to the challenges associated with it. And I think that speaks to athletic trainers in general. We all are very well known to be quite adaptable, change on the fly, right? Whether it be a schedule change or a location or, hey, I need you to do this tomorrow. We've been able to adapt, and from an academic program, I think we've done that as well. There's been a huge emphasis in healthcare overall on telehealth and telemedicine, and we have been able to incorporate that from the get-go. Erik can attest, as his class was getting ready to finalize their last semester of clinical rotations, and those were shut down and minimized. We were able to start doing telehealth and utilizing Zoom, right, as we're using now. Now we actually, OSU is fantastic in the fact that they brought us actual software that allows us to record and allows our standardized patients to utilize telehealth and telemedicine. So we did that really for the first little bit, but really starting June 1st, life didn't really change all that much for athletic training. We brought students on campus July 1st. We did do a little bit of online only for the first few weeks for our new cohort, but I am very happy with the fact that, we have a fantastic space here. Plug for our external affairs group. If you haven't seen our facilities video that came out last week, check it out on our YouTube channel or Twitter. I'm getting better, Erik, at Twitter, I promise. But we do have a facilities video that shows you a lot of our space here on campus and different opportunities. But we had plenty of space to adapt and allow for students to come on campus July 1st. I'm also really excited to say that we did not have a single student miss out on a clinical rotation. We switched some things around where we didn't send students to the hospital in the summer. We sent them in the fall. Ironically, we thought that it would be better, but be it as it may. But we had every student finish all of their clinical rotations, other than our group last spring when we didn't know what we were doing with COVID, as a country, as an institution. But we've been really lucky with this adaptation of being able to think on the fly and still maintain high quality clinical rotations. Props to our preceptors. I can't say enough about how fantastic our preceptors have been to integrate our students and to still maintain the high quality education that we require. So I guess, Erik, how did you guys adapt to COVID and all that fun stuff?
Yeah. I mean, going back to some of your points, like even finishing up my last clinical rotation there at NC State, like did some kind of telehealth stuff with some more long-term rehabs. So yeah, like my clinical experience really kind of ended whenever like it would have. It was just obviously looked very different, but yeah, kind of managed it through phone conversations and FaceTimes and a Google spreadsheet of their program and all that sort of stuff. So it was, yeah, I mean, just trying to kind of, like you said, make lemonade out of lemons. But golly, I mean, adapting to things here, I mean, there's kind of two sides of it. Like at the NFL level, like we just have so many resources. Like we're not going to sacrifice patient care with these guys that are doing what they do, on a weekly basis. So it's figuring out how to make it work around all the, modifications and limitations that we have and all that sort of stuff. So, like I was kind of talking about before we got going, like I really didn't envy my boss's jobs because they had to do so much as far as, man, like filling out reports and making sure they were on calls to make sure that we, had like the updated, policies and procedures based on, what trends we're seeing out in the nation and trying to keep our players as safe as possible through everything. And again, at the end of the day, I don't think it changed what we did clinically that much. Which was really a blessing. I know for some people it changed what they did a lot, but at this level, I think our again, a testament to my bosses, like really do a great job of putting, the player health and well-being before, anything, even ourselves at points, but that kind of comes with the territory. But yeah, again, I think we did an outstanding job of making sure that these guys were safe. I think we, at the end of the season, I can't remember what number we were, but we were in the like top 2 or 3 like fewest cases throughout the league or something like that. So again, it's really a testament to the organization and everything that they provided to support us through this. And there's a big educational component at making sure guys understand like it's important to wear a mask. So and so tested positive. Like it's especially important to wear a mask. And again, just doing everything that we can to make sure they understand they're on board and everybody's kind of driving the ship in the same direction together. So but yeah, I mean, as far as like what it would look like compared to a regular year, like we have, if I stepped outside, we have these plexiglass dividers between taping tables and treatment tables. And, we had N95 masks on planes just because, you still got to travel to the games and everything. I think like had we made it further in the playoffs, we might have gone to 2 planes just to be, extra sure. So again, like the resources are there because we want to make sure that we play. But again, definitely a different looking year. I don't really know what a normal year in the NFL looks like, to be honest. But I can tell you, yeah, it's definitely not normal. So yeah, but you figure out a way to make it work. And again, I would say we were successful in that thanks to the organization and some good, strong leadership.
Great. Well, thank you guys. The industry certainly has changed throughout the seasons, and OSU has done a great job at helping current and past students navigate through those challenges. Now, can you talk about what initiatives you have moving forward? What is on the horizon for athletic training and for athletic training at OSU? So, Dr. Volberding, let's begin with you.
Sure. I think that the future is really bright for the profession of athletic training, and I think the future is extremely bright for the OSU athletic training program. We are, as I said earlier, our largest cohort is coming in here in June. We're really excited about that component. Where we're really looking to grow is continuing to grow our clinical education opportunities. We currently have almost 80 different affiliated site agreements. And I think it's props to the students like Erik that have said, I want to go to this area, or I want to go to this space. We're really proud of that piece. And I'm going to show you guys just a small snippet of really where we're at. So clinical education has always been the biggest component, right? So we do integrative 8 weeks of class, 8 weeks of clinical opportunities, other than the last semester where they actually do 13. This is actually an outdated map. We just added 2 additional sites in California, San Diego State University, and a small therapeutic clinic. We added an additional site down in Florida in the Tampa area. But students have really taken the challenge and taken the initiative about traveling all over the United States. And it's not just in the athletic training program where, in local or national, we are always looking to our alumni. We're looking to our physician partners and creating different opportunities for our students. I think where we are looking to grow additionally is in this idea of interprofessional education. I think we're just scratching the surface of the opportunities that we can provide our students, both in the classroom, in clinical simulation, but then also in our clinical rotations. I think that we continue to grow in the opportunities and the qualities of the non-orthopedic, that partnership with the OSU Medical Center. We also are really, again, looking to grow simulation and standardized patients. This was something that we had never done before we came to the Center for Health Sciences. We had one mannequin. He wasn't very fancy. He did the basics of what we needed at that time for the older standards. But the opportunities that are provided by being on this campus are amazing. For us to be able to replicate multiple patients at one time, having to triage a heat illness scenario. We ran an active shooter event where we had 6 patients who our students had to triage as a group and deal with. That was fantastic. We saw the acting ability of some of our students and staff. But we really have taken the opportunities that were provided by moving to the Center for Health Sciences, and we are not taking no for an answer. We are continuing to grow and continuing to do that. We are all about enhancing the mission of OSU, right? Rural health. We are advocating for athletic trainers in our rural communities. We are advocating for partnerships for our College of Medicine graduates and recognizing and having them be our advocates to get athletic trainers out into our rural communities. But I would hazard a guess to say that Erik and Matt would echo my statement in the fact that we did not know at all the amazing potential that we had here. I mean, we had, again, just a glimmer of what we were doing and making that choice to come over here, and the sky's the limit. And we're really just looking there. From a programmatic perspective, I think hopefully in the next 5 years, we'll create either a residency program and or a doctoral program. Those are large scale ideas that we have because we want to continue to push the profession forward. But it's really, making sure that our students, our graduates like Erik and his classmates are going out and making an impact on the profession. And I think we're really proud to say that they are doing those things.
Great. Thank you so much, Jen. How is the future looking for athletic training outside of OSU, Erik?
Good. Looking for a full-time job. But yeah, I mean, there's some things in the works for me, but yeah, I mean, just speaking as a kind of a, larger scale for the profession, I mean, I think the future is very bright for athletic training. I mean, having come from strength and conditioning and then physical therapy, I think athletic training still has a lot of room to grow, but I think that's only a positive for the profession. Being on the NATA student leadership committee really opened my eyes to like how involved it is kind of behind the scenes at the national level, and how important it is to continue to stay involved. Actually, I interviewed for, they kind of are shaking up the young professionals committee and are kind of breaking it up. And I, along with two of my other, I guess, colleagues on the student leadership committee, we interviewed for the chair position, didn't get it, but that's something that I look to be involved in, as maybe like a district representative. But it's so important for us to again stay involved at the state, the regional, the national level to continue to push the profession forward. Because I mean, coming from, again, those other backgrounds, what athletic trainers bring to the table is not less than any of those. I mean, it's the same, if not more than, again, or maybe not more, but we're healthcare providers. I mean, there's no question about it. So growing those opportunities to bill insurances and be taken more seriously in what we provide. And it's cool seeing the APTA, the American Physical Therapy Association, and the NATA kind of starting to hold hands together and put together like a joint statement. And mentioning social media earlier, there, I can't remember, I think it was Arkansas, there was like some, I don't know who he was, but essentially gave a very, very poor description of what athletic trainers are capable of. And seeing the kind of outcry from not only athletic trainers, but physical therapists and medical doctors and all these other people that, I don't know how it would have been maybe 10 years ago, but you see a lot more people kind of rallying behind the field of athletic training, because more people are starting to realize what athletic trainers are capable of. And again, just once we kind of breach that level of showing our worth, not just to our athletes and coaches or clinicians that we work with, but hello. There we go, sorry about that. But again, like really getting into like state legislature and in bills and things like that, I think that's where we'll kind of the next step. But again, something that I see on the horizon that's just going to continue to push the profession forward.
Great. Do you have any advice for alumni to give back and get involved?
I mean, take students, I guess, if you're capable of doing that. It's something that, once I'm kind of in a place where I'm able to do that, I hope to do that. And beyond that, I mean, if there's ways you can get involved at the state level, again, regional level, national level, yeah, I think I see more need, but that's more exciting to me, like as far as being involved in NATA as opposed to some of the other national associations. But again, I think it's an exciting thing, and I think a lot of people wind up being kind of intimidated by it, like, oh, I don't know what I would do. Well, yeah, somebody knows what you can do. So if just throwing your name out there, if it doesn't happen this year, most people aren't going to turn away help. Like I'd really say that, and if it doesn't happen again this year, like it'll happen probably next year. Like if you're on somebody's list of a way to help out, they're probably going to find something for you to do. And it wound up being that National Student Leadership Committee wound up being like, I mean, shoot, connections I made there are what helped me land this job. And there's still friends that I talk to on a daily basis, and it's a network that I've reached out to other people, and they're now connections, and you just build your network from there. And I think I got more from doing that than what I put into it, and I don't think there's really any negatives to it. If you take a little bit of time, the amount that you get back is tremendous in my opinion.
Awesome. Well, the future continues to look bright for OSU CHS and athletic training. We're so excited to see what the future holds for OSU and for you, Erik. So thank you to Dr. Volberding and Dr. Arvay. I appreciate taking your time out of your busy schedules to visit with us. We have Cowboy conversations scheduled throughout the year. Please be sure to check out our website to stay up to date for future events. And thank you all for joining us today.
And I also put up our newly revised website where there is a direct link to our facilities video. So for those of you alumni who haven't been on campus, it gives you a small glimpse of where we're at. And if you're ever in Tulsa, give us a call and come on campus.
All right. Thanks, everybody. Have a great afternoon.
Thank you.